Hi everyone, let's see how Kerala tamed the coronavirus. The inside story of how one Indian state is flattening the curve through epic levels of contact tracing and social assistance. The sun had already set on March 7 when new Pulachal Baba received the call. "I have bad news," his boss warned. On February 29, a family of 3 had arrived in the Indian state of Kerala from Italy, where they lived. The trio skipped a voluntary screening for COVID-19 at the airport and took a taxi 125 miles, 200 kilometers, to their home in the town of Rani. When they started developing symptoms soon afterward, they didn't alert the hospital. Now, a whole week after taking off from Venice, all 3, a middle-aged man and woman and their adult son, had tested positive for the virus, and so had 2 of their elderly relatives. PB New, as he is known, is the civil servant in charge of the district of Pathanamthitta, where Rani is located. His boss is the state health secretary. He'd been expecting a call like this for days. Kerala has a long history of migration and a constant flow of international travelers, and the new coronavirus was spreading everywhere. The first Indian to test positive for COVID-19 was a medical student who had arrived in Kerala from Wuhan, China, at the end of January. At 11:30 that same night, New joined his boss and a team of government doctors on a video call to map out a strategy. For some, this wasn't their first time fighting a deadly epidemic. In 2018, the state had dealt with an outbreak of Nipah, a brain-damaging virus that, like the coronavirus, had originated in bats and transferred to humans. And, as with COVID-19, there was no vaccine and no cure. 17 people had died, but the World Health Organization, WHO, called Kerala's handling of the outbreak a success story since, despite technical shortfalls, the state's health system had contained a potential disaster. This time, though, they would need to go further and move faster. By 3 a.m., the team had settled on a WHO-recommended plan of contact tracing, isolation, and surveillance. It had been used to limit the spread of Nipah and on the medical student in January. The plan relied on consulting patients, mapping their movements to see who they'd interacted with, and isolating anyone in the chain with symptoms. There was, however, one obstacle. The family weren't forthcoming, says New. They were in isolation at the district hospital but didn't want to declare the full extent of their movements. It was as though they were embarrassed. At this point, 31 people had tested positive for COVID-19 across the country. It was a small number, but the virus was fast-moving. On average, one person was thought to infect 2 to 3 others. This spelled bad news for India. Many of its 1.4 billion residents live in large families and don't have running water, making it difficult to sanitize things and maintain social distancing. Even countries with advanced healthcare systems were being overwhelmed, and India had just 0.5 hospital beds for every 1,000 people, a long way behind Italy, with 3.2 beds per 1,000, and China, with 4.3. In addition, there were only 30,000 to 40,000 ventilators nationwide, while testing kits, personal protective equipment for healthcare workers, and oxygen flow masks were also in short supply. It was clear to New and his colleagues, the only way to control transmission was to break the chain. New, who is 40, with a thick head of hair that he combs dutifully to one side, is a soft-spoken man who lives with his wife, a medical student, close to his office. In 2018, when a flood swept through the district and left more than 24 people dead and 20,000 houses damaged, he had led relief efforts, and got no more than 2 or 3 hours of sleep at night. Admirers started a Facebook fan page called New Bros Arc. The experience taught him not just how to manage people in a crisis, but also how to read them. He gauged, correctly, that this family from Rani would be intractable. So rather than rely on them, He turned to old-style detective work and technology to piece together where they'd been and who they'd come in contact with. PB knew, a civil servant in Kerala, saw quickly that the only way to control transmission was to break the chain. He brought in 50 police officers, paramedics, and volunteers, and split them into teams. Then he sent them out to retrace the family's movements over that crucial week. They'd given his district officers scraps, an address here, a name there, but News Task Force expanded it dramatically, using GPS data mined from the family's mobile phones and surveillance footage taken from the airport, streets, and stores. In a matter of hours they had learned a lot more about the family's movements than they'd been told, and what they found alarmed them. In the 7 days since arriving in Kerala, the family had gone from one densely crowded place to another. They'd visited a bank, a post office, a bakery, a jewelry store, and some hotels. They even went to the police for help with paperwork. Stay tuned for next episode.